Hey, my medical coding family. Anybody want to do any practice exam questions? I'm live here and on Tube of the U. If anybody wants to view a better screen view over there, but both will work. I've got some practice questions up on the screen. Thanks for sharing out the live. Thanks for the tappy taps. Thank you, thank you, thank you. That's awesome. Let me know in chat what you guys think is the answer. Two. All right, let's see. That is correct. Good job. What about this one? This will be tougher. What do you notice about the different answers? Sometimes it's easier to go to the different answers first before you read the question, because if you know anything about musculoskeletal, do we times 2 codes in musculoskeletal? Or when we add 2 codes together, do we add a modifier? What's the normal pattern? That might help you pick out a correct answer a lot faster. Hey, Davis, how are you doing? Doing great. I'm sitting here working on a PowerPoint presentation for my next boot camp, which we're doing in a couple of weeks. It's an 8-hour presentation, so swapping out the questions for those so that they're a new set of questions and getting ready for that. I have a class tomorrow that I'm teaching, also preparing for that. But for a little bit, I thought I'd hop on a live while I'm playing around with some of these questions, see if anybody wanted to do some. My wrist is killing me. I got it K-taped up, trying to get that carpal tunnel to stop messing with me. But if anybody has any solutions for carpal tunnel besides a wrist replacement, I'm getting too old and all the cartilage, well, collagen around my nerves is shrinking, of course. You know, that comes with age. So my nerves are being exposed. Need more collagen. What do you guys think is the answer for this one? Put it in chat. Hey, Go Kart. Good to see you. I went through some of those questions you put on my website. I corrected the first one you added. It still didn't have those little thingies slid over, the anatomy one. I don't remember what it was, but I fixed it. And then the other, like 5 or 6, looked great. So thank you so much for helping me out and putting those questions on my website for me, since I'm having trouble with this wrist. Hey, AJ, how's it going? Hey, Pennywise, good to see you. Anybody want to put in chat what you guys think is the answer? B? You are correct. Good job. Perfect. What about this one? Did we do both sides, medial and lateral repairs, or did we do one-sided repair? That would be helpful to know for answering this question. Thanks, guys, for tapping and sharing the live. You guys are awesome. The wind is blowing. We've got like 35-mile-an-hour winds. It's really crazy. Hey, Hippie, how are you doing? Hey, Steph. Good to see you guys. Got 17 of you guys in here. Let me know in chat what you guys think is the answer. I got my medical and billing certificate back in 2010. Ah, bride. Have you scrubbed your social media so that your Facebook, Instagram, um, all that stuff is happy, appropriate, professional material? Then the second thing, have you participated and joined in your field, right? Do you join in still on your monthly medical coding chapter meetings? Are you attending national conventions? Even if you do it virtually, it's very helpful. Do you know who your chapter president is? Do they know that you're looking for a job? Are you attending your local chamber of commerce open houses? So every time they open up a new medical wing, hospital wing, or there's a health fair, are you attending with your resume in hand, letting people know that you're a medical coder in the field and you're happy to help them out if they need help? Um, have you contacted people like Project Resume who will redo your LinkedIn and social media profiles for you? They will redo your resume and your cover letter because they are CPCs and CPC instructors like I am, and they will rewrite your resume and LinkedIn profile so that it is appropriate for current market. And they also end up giving you a book that goes along with helping you find a good job in the current field. Are you looking into IDR? We've got a new federal program that just started that is in desperate need of medical coders and medical billers. It's a program that is an arbitrary system that goes between the providers, health plans, even hospitals and the health plans. And when both of them disagree with a claim and both of them are not happy with the outcome of the claim, our new federal IDR program is an arbitrary um, service that the federal government provides for medical coders and for claims and stuff. We need people in that system and bring it up from the ground up. We have the laws in place, we have funding, but we have no employees that will build that program up. Are you participating in and getting your monthly magazines like um, this one, for example? Are you reading this magazine monthly? Do you know what's going on in our industry? Um, are you looking at the written articles of each of the articles inside our magazine and looking where these people are working, right? What jobs they are doing, because they all have profiles. Every single page of this monthly magazine that's included in your membership with AAPC actually has jobs listed that you wouldn't even know to look for. Like, are you looking for, and have you been to the NCQA website? Have you been to the CHAPS website, CHAPS? Both of those websites are industries that medical coders and billers can get into. I was a HEDIS auditor with NCQA, making six figures when I retired this year. Do you know anything about HEDIS? That is super helpful. There's another article written by this person and the jobs that they do that might be different than what you're thinking about. Because if you're only going to job hunting websites and only putting in that you're a medical biller and you're only looking underneath that name, everybody else is looking under a medical biller. You need to be looking under um, a greater range of things that you can actually do since you now have that certificate. Are you actually certified? Do you have a current certification? Just having a completed degree is not enough. You do need to hold a certificate and a current certification in the industry. You actually do not need a completion of any degree. You can get into this without going to school. All you need to do is complete one exam for your certificate, and then you can get into it. But all these magazines tell us about who these people are and what jobs they're doing and what jobs they hold. And looking up that information is really helpful because you can find yourself in a lot of positions. Even companies that make EHRs, healthcare charts like this, um, also have tons of openings. I have been a super user with an EHR company that's a data warehouse called MDX out of California. And just because I knew their system so well, I know that if I ever wanted to go back to work, I would just call them up and say, "Hey, I'm in the market, need a job. Let me promote your stuff," whatever. And I would be one of their medical coders for the MDX system, that when a company decides they want to look at their company and use them for a data warehouse, I would be the one that would train all their new companies that signed on for their system, because I'm a super user. I could import all their data, train all their employees, including their providers, the physicians and their medical assistants that are in the system, and show them how to use it. A lot of EHR companies need medical coders to get into the position too. Did anybody figure out the answer for this one? There are so many job opportunities. If you are wanting to get into the career and get a position, there are way too many positions. We need more staff for sure. And there's so many directions that you guys can go into. What do you guys think is the answer? Of course, these questions are exactly like what you will encounter on your certification exam. They'll probably have a different scenario. Instead of just saying a medial and lateral meniscus, they're going to say on the certification exam, Mr. Jones came in with, you know, a long history of bilateral knee pain. Today we did an endoscope. During that endoscope, we did a medial and lateral meniscus repair, which was performed. And instead of saying arthroscope, they might say endoscope or some other word, just trying to confuse you. But it'll say the same thing, and it'll be a multiple choice. They just tend to be just a little bit more wordier than this one, just because they like to put in a lot more vocabulary just to confuse you. Sure. About the resume thing. So, um, if you go to my website, Medical Coding by Jen, right here, this is what my website looks like. Um, if you just scroll down just to right here, I've got the link right here, which is called Project Resume. See where that green hand is right here, that yellowish, or right above the yellow thing? It says Project Resume. If you click on that, it'll take you to Jacob and Anna's website. I can click the About Us and you'll see them. These are two AAPC instructors who own their own resume company, and they will redo your resume right here for you guys. They have three different options. Um, and for 97 bucks is their most expensive one. They'll redo your resume, cover letter. They'll give you a book, a job guide, and then they'll redo and overhaul your social media profiles like LinkedIn and stuff. But that's their most expensive package. Their cheapest package where they just redo your resume is 65 bucks, but you can save 10% if you want to. If you put Jen, like Jennifer, JEN 10 at checkout, they'll send me 10% of your 65 bucks, maybe one of these days. And then they'll um, give you 10% off. So whatever they take off, they just send to me on top. So it's like 20% really they're losing. But anyway, they're great. They're AAPC instructors, and you can read all about them too right there. And they will help you um, redo your resume and help you, and they'll be your resource for getting a job. So they're right here on my website at Medical Coding by Jen. Right underneath this lady's elbow, it says Project Resume. You can click it right there. My Amazon list is right there. If you're looking for what pens do I use, what books do I buy, all that kind of stuff. Where do I get all this stuff? How do I make my book holder, Lazy Susan thing that I use? All that kind of stuff. What highlighters do I use? That's all in that Amazon list right there. The questions that we're doing right now are from Pocket Prep. The link is right there underneath the Amazon list. 750 practice questions from AAPC. You just click on that link right there. Go to the word medical, and AAPC is right there, top link. And 750 practice exam questions. And they have a pass guarantee in all 18 areas of the exam, and their prices are way more affordable than even AAPC. I pay $8 a month because I buy a whole year at a time. But even if you want to do 3 months for 40 bucks, it's right there. Super great value. You can cancel your subscription the day you sign up, and then that way you don't get auto billed. But if you just sign up, you get access to all 750 practice exam questions for what, 40 bucks? Great, great value. They do have a pass guarantee. You get cases, you get E&M questions, you can build exams however you want. Today, I am doing practice questions from E&M, musculoskeletal, and lab and path. Yes, the current boot camp is great. You can use it for your exam on the 19th. It's wonderful. I've done it twice. Even the one from July is perfect for the current exam. I'm only redoing it, not really because the material needs to be updated. I do have a couple of new areas in 3 areas where I'll add a new question in. Like cardio, we had like 8 more codes that were added, and I know one of them might be on the exam. Same thing for radiology, and same thing for the male genitalia. But it's just one question in those 3 areas. But the rest of the boot camps are perfect. And there's no guarantee that you get that one new question because they have a pool of 1,000 questions when they make your exam on your exam day. it's unique to you. They don't have a set exam for everybody that they give out. It is auto generated by that pool of questions. So you could not get them, you could get them. But as little birdies tell me what they thought they could find, or if I see a social media post of people that say this certain subject was on their exam, then I'll update my boot camps as it is. It does make people nervous that I made that boot camp in October, but you're talking about a big major corporation, right? That has to change the way they do something for it to affect something. And change is slow with big corporations. There's absolutely nothing wrong with either one of those. It's a $40 boot camp. It's 8 hour long video. You get to watch it whenever you want, as many times as you want. And I still firmly stand behind both of those. They are increasing people's scores on their certification exam by 20 or 30 points so that they can pass. So they're great. They're great. And I'm not even going to change the PowerPoint presentation. I'm just swapping out some of the questions. And then I'm going to say the whole thing again in March, but it'll just have some new questions in it, but nothing major. Or I might rewrite a question with more, you know, Mr. Jones did this, but it's the same question, but it has more fluff in it, those kind of things. But it's still the same thing. It's still a mini course overall, 18 areas of the exam. My predictions inside each 18 areas of what codes you might see on your exam. I'm not a wizard, but if I was writing the exam, these are the tricky areas that I would focus on to make sure you know the difference. I'll teach you about those differences and what's the tricky part about those code descriptions. And then we'll do practice questions in that area and then move on to the next. That's why it's 8 hour long video. But it's absolutely perfect for your exam on the 19th. Jen, I wanted to say after 100 days, 11 interviews, and 2 job offers, I finally accepted a position. Woohoo, Bluey! I'm so proud of you. That's awesome. I know you've hung out with me forever. Woohoo! The great thing about this is you stick in that job 6 months to a year, even if the pay rate or the situation, whatever it is, isn't 100% perfect for you. Stick with it 6 months to a year. And then you can just be like me and just be calling up people and say, hey, I got this skill. I've got this time with this company. I want this position. Or you can start turning down job offers and saying, well, if I had more vacation time or if I had this pay right, I might think about it. But thank you for the offer. And then have them call you back and say, okay, we went back to administration and we were willing to give you that offer. You just need a little time underneath your belt, and then you'll be able to request the job that you want, which is really lovely. And then double your income every 3 years. Just, don't stick stagnant in a position and accept your 35 cents an hour raise yearly. Don't do that. Be sure to switch out. And then when you switch from one year to another or whatever, however long you want to stick with the job, always put down a way higher salary rate than what you did actually get. And then ask for the moon. You know, it's no big deal. Yes, please go watch it again. Absolutely, 100%. So happy for you, Bluey. That's awesome. Yes, make notes. Yep. Some of those questions are on the exam, like when did HIPAA become law? I'm sitting here looking at those pages right now, right? When did HIPAA become law? Any questions that say which one is or does not include, which one is exempt from this. Anytime there's a question on my boot camp that says it's written in a way where you're looking for an incorrect answer. All these are true except stuff like that. 100%. That's the exact thing you're going to see on the exam question. So get really good at looking for incorrect answers on some of those wordy questions, especially for the business of medicine. Who's responsible for enforcing HIPAA? It's not CMS. It's not even OIG. Do you know that? Those kind of things show up on the exam. It's a different entity that you wouldn't even think of. It is the Office of what? Anybody know? Yeah, you can still use your 2025 books. Hey, Rachel, except you need to go write in the new codes for cardiology, radiology, and the male genitalia. Those 3 sections. You need to get the new codes and write a little bit about their description in your 2025 books. 100% please go do that. I have a document, of course, on my website. If you guys want to go download it, it turns a 2025 book into a 2026 book on your CPT section. It's like $20 on my website. But legitimately, you can go find out what are the new CPT codes in 2026. Go ask ChatGPT, whatever. Go find them. They're on aapc's website in the Knowledge Center. Totally free to go there. You can probably even find them on the AMA CPT website. But those 3 sections in your 2025 CPT book, go write them in and, yep, do that. Hey, Jess. My Jess, so good to see you. What, 6 years? 7. 2019. This is 2026. Girl, where's the time fly? It just flies. And I know I've missed so much. What 3 sections? I said cardiovascular, radiology, and the male genitalia. 4-1 test. If you are doing a HIMA CCS test, you cannot use the 2025 books after 4/1/2025. If you are doing AAPC, any of their certification exams, you can use the 2025 books all year long for 2026. It's been since 2010. I feel like I don't know anything anymore. If you still hold your certification, then you're doing continuing education CEUs every year. Then you do know something because you have to have that knowledge to even pass those CEU tests, to even keep your certification. If you're not certified, then look into getting certified. Just get the AAPC study guide for 2026 and get the practice questions. Update your manuals, your CPT manual and your ICD-10 manual. Do the practice exams, read the study guide, and do the exam. I did my CPC, my CPMA, and my CPC instructor exam all without a course and just took the certification exams with the study guide and the practice questions. If I can do it, you can do it too. I did first grade twice. I mean, I'm not the most intelligent bird out there. They tested me for everything under the sun and still held me back because I just couldn't learn like in a classroom full of students being read at. That wasn't my thing. I kind of have to get things and do them to know how to work it right. But that's just, I learned differently. dyslexic is all get out. And then I'm always more worried about everybody else in the classroom. And if they're okay, then worrying about studying or learning the material, I guess, at the time. I have to be a hands on learner. What did you guys think about the answer for this one? There you go. The Office of Civil Rights. Yeah, that's who's responsible for enforcing HIPAA. Good job, Go Kart. What about this question that I have on the screen? Isn't that weird that the civil rights people are the one that enforce HIPAA? Do you know who a covered entity is for HIPAA? People always, in a ton of internet social media posts, saying that's a violation of my HIPAA rights, my medical records, my whatever. Well, patients are not a covered entity in HIPAA. HIPAA is meant and is written to protect who? The physicians, your medical practice offices, your medical assistants who send your medical records out over the faxes or whatever they're using, right? HIPAA is meant to protect them. They're allowed to go into your record, pull records out, and send them to other people. That's what HIPAA is protecting. The HIPAA is not protecting a patient. So that's kind of, I'm always like, you know, there's too many of those kind of things going around on the internet to make a comment and try to educate everybody on that. But those kind of things are what are asked on the exam because it's the things that most people get wrong all the time because people assume it's there to protect the patient. No, 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 no. No. PHI. I saw that, Bluey. You rock. That's awesome. Hey, Jen, I take the CPC after the NRCCS. That's awesome. Hope you do well on that CCS. I'm not certified anymore. I need to do the exam. Use the, I like to use the McCary app. It's kind of like eBay or Amazon. You sell your stuff out of your closet on McCary. Um, the United States Postal Service will print your shipping label, and then I just use my here's what the app looks like. It's that one right there. I use that and sell everything out of my house that I haven't looked at or touched in 6 months. Like the kids have a corn snake and she sheds, right? So her sheddings people buy to make earrings and whatnot, whatever. I just post it up on my carry and sell it. And then I don't pay for shipping because the customer pays for the shipping. They direct deposit the money into your checking account and there's no PayPal fees or anything. I love my carry. I've been using them for years and um legitimately, like, let's see if I can get this to come up. Look how much I've made on that. $8,000 from just selling junk out of my closets, right? Anything that I don't use anymore, old paper towel rolls, people that craft love it. You can penny shop off of McDonald's toys, right? Just little things that I don't need. Walmart, if like Valentine's Day, those are Valentine's Day socks. They'll sell them for like 25 cents the day after Valentine's Day. And you can get them for a deal. And then if I sell them for $10 with free shipping, then I turn 25 cents into $5, right? Shipping will cost me $4, whatever, if I do free shipping. Most people that sell on McCary do do where the customer pays for shipping. But if I put free shipping and I pay 25 cents for those 6 pairs of socks, right? Then I've turned 25 cents into almost $10. It's great. I don't care. And they're happy that they got free shipping and 6 pairs of socks that are cute, right? So, this is what I use to pay for my books, my membership, my car tags, stuff that I forget to save for all year long. And I've never had a problem. They don't come back and take money away from you like in 30, 60, or 90 days like eBay does, right? They it's 3 days after the customer gets the item. Either they love it or hate it, and that's it. The deal is done, and then you get the money direct deposited in your checking. Love McCary. Been using them for probably almost 10 years now. Love it. Love it, love it, love it. So, Miss Cher, Bride, get on that app and sell everything that you haven't looked at in 6 months. That'll help you pay for your certification. Help you get your new books, help you get your practice exam questions, help you get, your membership fees, all that kind of stuff. Even your exam attempts, right? They all cost. This one, the answer is on page 211 on your AMA 2025 CPT book. Ooh, E&M question, finally, right? This one's a big good one. These questions are from Pocket Prep. Love Pocket Prep. I have the link on my website. If you go to medicalcodingbyjen.com and you do click on this link right there, it's right underneath the little lady's wrist. They will send me a little bit of whatever you spend, which is great, because I give it back to you guys. But they have access to, it gives you access to 750 practice questions that are AAPC, just like formatted, just like AAPC. They also give you page numbers where the answers are located inside your AMA CPT book, your ICD-10 book, or your HIPAA, which is wonderful. I learned more from Pocket Prep than I did with anything, because the way my brain works is if I can reverse engineer the answer, know where they got the answer, but then I have to hunt for it on that page, right? That's not such an easy thing. They might tell you it's this page number. You'll go to it and you just don't see it, right? Because it's a parenthetical that's underneath a different code that you didn't think of, or it's written in a guideline in a big long paragraph. You really got to hunt for it. So being forced to look for it like it's a treasure hunt helps me learn more about how to use the manuals. And then the more that I learn to use those manuals, the better I am at doing any question that is thrown at me on exam day. Inpatient coding, yes, absolutely. There's some really good ones about the post-op care and seeing if they can get you to bill an E&M code, or are you doing a medicine section post-op visit? Are you using your appropriate modifiers, that kind of stuff? Or do you not bill a procedure at all because it's already been included? Pretty cool. I love treasure hunts too. Yep. Let's give away some memberships. So if you're on my YouTube channel, I have exclusive videos that will show you guys how I make my notes in my CPT, ICD-10, and HIPAA book. I'll have videos where I'm doing PCS or, even updated ones for the new male genitalia section that had a lot of new codes this year in 2026. So all those videos are on my YouTube channel where I'm going code by code, making my notes in this area. And if you want to watch the videos on how I make these notes so that you can do your certification exam the first time, hopefully, and pass, I have a lot of exclusive YouTube videos that you can only get with the $5 membership. But I am fixing to give away 5 YouTube memberships to anybody that's logged on and is inside my YouTube channel watching the stream right now. And that will give you free access to 30 days worth of my book prep videos, my workshop videos, where we do 75 questions in 3 hours. Same pace as the certification exam. It shows you how to do the process of elimination, all that kind of stuff. It also gives you access to the podcast where I'm just reading out the guidelines sentence by sentence and then stopping and telling you in layman's terms, what the heck does that mean? In my own genism, I guess. And then, I'm building a medical coding course set of videos. It gives you access to those, that kind of stuff. So, if anybody is in that chat room right now, be sure to make comments because usually it picks people who've commented recently. All I do is throw some money at YouTube and then they pick winners. You can comment when you plan on taking your next exam, which exam you want to go for, or who's your exam buddy. I've got Lester over here looking at me. He's my fur baby. You can comment anything in chat. And let's give away 5. Throw them some money. You guys tell me also what the answer to this question is right there. All right, let's see. Mitcha, Maggie, Melissa, and Danielle McMullins. I got a sister from another mother with that last name. Used to be last name. She's married now. But good to see you. Awesome, JN. Every time I go live on YouTube, I give away 5 memberships. So keep hanging out on YouTube and you'll win one for sure. JN has been a member for over 6 months on my YouTube channel. Wow. Thank you so much. All that content support helps out so much. I hope the extra videos help out. Katrina, she's not home yet. I don't have my books. That's okay. It's fun. 8,805 has become a member. It is good to practice even without your books. Practice looking at the available answers and just guessing based off looking for numerical similarities. Like 3 of them start off with 993, right? Then your cheapest or smallest number is the 84, right? What other processes? You can find patterns in your available answers and not even read the questions and see what you think might be the answer. It's kind of cool. Mech. Thanks for the heart me's. Those are the absolute best things ever. Love the heart me's. All right, what do you guys think is the correct answer? I'm glad I saw you on TikTok. Me too. Juanita? Thank you for the thumbs up on the YouTube channel. Thank you for the tappy taps on TikTok, sharing, copying the links, all that good stuff. I love McCary, guys. Seriously. That's how much I've made. My name on there is like Fruity Pebbles. So if you guys ever see my shop open, it's Fruity Pebbles. I don't know why I named it that, but it's Fruity Pebbles. Every Christmas and stuff, I'm always on there trying to sell for all that kind of stuff. Keep help pay for Christmas items. Car tags are usually due at that time, always, for some reason. It's crazy. You have taught me so much. Hey, Samantha. I miss seeing you. How's it going? I don't think I've been live even on YouTube in like a month. My wrist has just been really killing me lately. I got it all taped up. And then the boys, two of my three boys were hospitalized, and that was traumatic. And then I've got a current CPC course that I'm teaching for aapc, so that's keeping me focused and haven't even been live on YouTube. I feel like I'm neglecting anything. Good try, Norma. It was 99384. You see how I looked at all the available answers. I noticed that 3 of them had 993 in them. And then if I put all those numbers in numerical order, the smallest of the number was the 84. And that's what I said kind of as a hint that I thought the answer might have been. It was looking for similarities and then just picking the cheapest, smallest number. And that was the correct answer. It's just fun to play with. What about this one? We've got a nurse visit, and then we've got a low, or we have a low, straightforward, and a low. We have 2 of them that are new patients because the 0 in the 4th digit means that that's a new patient. The 4th digit that's a 1 means you're established patient. Did this patient come in for just an established situation, or are they completely new today? We do see in the first sentence that they're established. So that means we can get rid of C and D right off the bat. If they saw a doctor, you know it has to be B. If they did not see a physician and they saw a medical assistant or a nurse or other staff in the office, then it would be A. A is the only one that does not require a physician. But we got physician recommends, physician did this, physician did that. This is not a physician code, the 111. So you know right away what the answer is if you know your headers of your E&M codes. And I have a free E&M quiz on my website for you guys so that you can learn your headers. If you happen to be on my website and you do go right here to the free resources tab, it's up there. Let me switch that to this one. Yep. So if you're over here on my website at Medical Coding by Jen, this is what it looks like. And if you go to the free resources tab and you go to the free practice area right there, that drop down menu, just click it. It'll take you here. It has free PDFs that you can download, like that one shaking at you. You just click it and it'll download. It has quizzes on it. You can just click on what you think the answer is to any of these, and it'll tell you what the answer and rationale is after you click it. You don't have to hit the whole exam to do it. So super cool. But if you come on down past all these free practice questions and free quizzes, you'll see this big blue arrow. And that is where you can join in on this free E&M quiz right there. Just hit view details and you can hit the start button right there. And there are 3 quizzes. See right here on the side? You've got 3: quiz 1, quiz 2, quiz 3. They're flashcards for E&M, and they're just meant to teach you the headers. Which ones are new patients? Which ones are hospital patients? Which ones are observation? Which ones are pediatric? That knowledge will help you on your exam. 16 questions on your exam could be about E&M. And if you know the headers of the numbers without looking them up in your book, that makes a huge difference. You can get through that part of your exam a lot faster and with more confidence just by knowing their headers. You're not having to run to the number and read the code descriptor on exam day. Once you finish all 3 of these quizzes, then do this drop down menu. It's here on every single page of my website. It says, welcome home to your medical coding family. Do the drop down menu right there. When you do, you'll see your orders and all that stuff, but it has programs right here. If you go to the program page and click on that and then leave that program that you started, like this one that I did, drop down menu, quit the program. When you quit it, that means you can go back in and redo it again. So you can go back to your home page, you can go back to that free practice area, then you can do all 3 of those quizzes all over again. And then that way, you get multiple times you can do them for totally free. This PDF of this heart you get to download for free too, right there on my website if you wanted to. But click that view details, scoochie down to the join, click join. Yep. And then now I've got access to all 3 of these quizzes and I can click on them. They're multiple choice. You just click what the answer is. If I was doing a 99484, what's my header? Is it disability, advanced care, behavior, or principal care? Try to do it without looking at your books. Do all of those, hit submit, see how many you got right, and then you can go quit the program and redo them. Really helpful to do your E&M this way, and this is all free on my website. I do have an $8 membership that we are working on right now, and we're adding in more and more practice questions right here on this page, where we're doing another program right here with all of these questions. So if anybody has that $8 a month membership right there, we've got practice questions that are going up right here in this one area too. So far, we've got questions. I got to sign in as a member, but we've got practice questions inside here in like 8 areas of the exam. We're getting up all 18 exam areas soon, but we do have a ton of other questions, of course, in this area that's already been included. Um, you know, this has a ton of questions in it when you have the $8 membership, plus all of those PDFs over here on the side that you guys get to download for the $8 membership. But this is just the cardiovascular questions that are already up on my website. And this is just cardio. There is so many on my website already posted, but we're building new exams every day, all the time for you guys. But this one's still cardio, still got cardio questions going on. There's so many. We even have little anatomy charts and stuff. That's a patient's chart. You get to fill in the blanks of the chart and stuff. And anyway, pretty cool. That's just all cardio. Anyway, I hope that's helpful. Let's go back to our practice questions for today. For this question, we finished that one. Let's go to lab and path. Oh my goodness. We got a good lab and path one now. Very cool. Would we answer this question with 1, 2, 3, 4, 5 CPT codes being billed? Would it be 4? Would it be 3? Or would it be 5? We've got 2 answers that start off with the same code. 2 answers right here that start off with the same code. This one has 5, this one has 5, this one has 4, this one has 3. All that information gives me a lot of information for process of elimination. Not for the certification exam. Do you have to know how to build codes like the sequence? Not for the certification exam. The available answers are already sequenced for you. Yay, thank you for completing the first stage of the club quest. Club cheers have been unlocked for all the fans to send. Thank you so much, guys. Hey, Elena. How's it going? So good to see you. Thank you for all the populars and the roses. I miss seeing you guys. It has. It's been over a month since I went live on YouTube and TikTok together. My hand is just killing me, guys, with that carpal tunnel. And then both boys were admitted into the hospital. It's pretty traumatic. And then I'm teaching for aapc, a cpc course, twice weekly now. So it's been busy. And I've been lazy too, I guess. No worries. So glad to see you guys. One son is in Cali today. He's going to go watch some boxing, wrestling. I don't know what they call it. They just put 2 guys in a cage, I guess. There's something fancy going on tonight. I don't know what. So, or I guess it's tonight. Yeah. So he's watching that with his Uncle Chris, and then he'll be back tomorrow. So the house is a little quiet with at least one of them gone. Travis here watching horror movies by himself. His besties have also gone to Cali to hang out with family members because this is spring break week for our kids' school. They don't have school on Monday through Friday. They're out on spring break. So it's really quiet in the house without some of the cheerleader team over on the weekend. Everybody's out vacationing. What do you guys think? I got 35 of you guys on TikTok. How many we got on YouTube? 14. What do you guys think? What is MMA? Is that what it is? Yeah, there's some sort of battle tonight. Yeah. I refuse to watch any of that mess. Oh, I gotta hit the puzzle thing again with TikTok, and I messed it up the first time. Try that one. There we go. There's our puzzle. But James, he does wrestling for his high school, and then he does jujitsu through his high school and weights class. So he's all into all that mess. So much info. Yeah. Definitely buying a membership. Thanks, Juanita. Yeah, that book prep videos are great. Don't worry about what year the book prep videos are. The codes do not change. It's a huge ordeal they have to pass through, like Congress, literal Congress approves these code numbers. So they don't change and they're used for billing and coding for a long time. So if you see me doing E&M videos from 2019 or whatever in their book prep notes, my notes are still the way they are. I have my own set of way that I make my notes. Every other teacher has their own set of ways that they make their notes, and I, love my notes, and it's what I needed to use to take my certification exam and pass. So I still stand by all of them. If the video's up, it's a great video. Go watch it and make the notes. The purpose is not to see, like, you're supposed to hear me, right? You're watching from a top video down onto my notes, and I'm handwriting, and my hand is kind of in the way as I'm writing the note, but I'm there and I'm writing the note. Listen to what I'm saying. I'm telling you what I'm writing. Go write it in your book. And then we do an area view of the whole page once we finish the page. And then you get to see it. But it's hard to show off every little thing while you're writing, in clear format. It's really hard. I don't know if you've ever tried to do that while you're creating a video. It's rough. You need like under the hand camera or something to watch and get the capture. I don't know. It's rough. Do I know how many codes were added in cardio? Yeah. Yeah. Uh, in general, it's just one section of cardio. So it's, let's see, a couple were revised, but they only took out a couple of words in those endovascular. Um, One of the new cardiovascular codes I hear tell is on the certification exams. I don't know which one, but I heard tell they wrote a question with one. I would check their um, monthly magazines articles from 2025 and early 2026 to see if they have a question in that area, because they often do. They do usually add the question in their monthly magazine. So it's new codes that are in the endovascular revascularization of the lower extremities of the arteries area. When you have a blockage in your legs, they added in some new codes around the iliac region. Um, 10, 20, about 30 something codes. There's a lot of them, but I was able to turn my 2025 book into a 2026 by handwriting these in. The differences between these codes are not bad at all. You don't have huge amount of stuff to write. You need to know if you did revascularization. Did you do something transluminal with a light up balloon? That's not that big of a deal. You first got to look up to see if you're doing that. Are you propping up the sides of the walls and adding the blood flow back into it? Or are you just guiding a balloon through there and stretching out the sides of that vascular? So that's the first two things so that you know which area you're going to be at. And then you just need to know which artery tree are you at, right? Are you doing the initial vessel, one of them, or are you doing additional vessels? That's helpful. And then where is your vessel? Are you popliteal? Where's your popliteal? Are you down on the ankle area, right? Or are you in what's else with popliteal? Oh, are you femoral? Are you near the thigh area instead of the ankle area? So just knowing your body locations is really helpful. So in those codes, I wrote the descriptors of the words that are going to make the differences in your exam questions and made it really easy to write those codes in so that you can tell which ones to pick. What do you guys think is the answer to the question that's on the thing? Yeah, there may have been a ton of new ICD-10 codes, but you only have 5 ICD-10 exam questions on your certification exam. There's no need in writing all 400 of those new ICD-10 codes. We know what they're going to ask you about on the certification exam. You know you're going to get a medical reaction to a medication, right? Whether it was intentional, suicidal, or just a reaction to a medicine that the doctor gave you. It's because it's a guideline question. They want to know, do you know what the answer is in that situation when a blood sugar pump machine breaks, right? And they get not enough medicine. That's still a drug interaction issue, right? So those are the ICD-10s that you're going to get. You also get a burn patient, right? That has a certain percentage of total body surface area that was burned. Your difference on the exam will be if you know where the ICD-10 code is for total body surface area of third-degree burns versus altogether all burns, first, second, and third-degree burns, all put together in one number. Do you know how to look that up in your ICD-10 book, right? You know you're going to get an OB and delivery one, right? Which Z code will not be on your exam question for available answers for somebody that delivered today, right? Or didn't deliver. Those kind of things are always on the exam. You'll also get a cancer question, right? Whether it's metastatic cancer or primary cancer. So there's 4 areas that you know are going to be on your exam, and those ICD-10 codes have not changed, and they're not needing any update for this year. So don't worry about all those ICD-10 codes. You're welcome. Hey, Nisi. Good to see you. Just the 2025 CPT codes, the CPT codes in cardiovascular, radiology, and the male genitalia. Those need to be updated. And I have a $20 document on my website that does it for you. You just copy what I have written, and it'll turn your 2025 CPT book into a 2026. Legitimately, and you can take it into your exam and have it on exam day with exactly what I have written in your book. No worries. No one's going to turn you away for it. C, you like just the 3? Good job, Samantha. Perfect. What about this lab one? If we're doing BRCA 1 and 2, what's the answer? Is it more likely that you would have 2 codes or 1 code? You're taking your exam in June? Yay. Best of luck. Best of luck. I'm also teaching the AAPC CPC course for AAPC. If anybody is like really wanting a full course and you want to take a year off your apprenticeship, I do teach it. I use my teacher discount because I bought the licensing from AAPC. If anybody wants to join in, you can have access to it for a whole year for $900 if you want to. That's available also on my website. under the course options. I also have a boot camp coming up this month in March. And then I have a new duck class coming up sometime. That's a 2-hour class where we do practice exam questions. When is that coming up? And that's like $6 if anybody wants to join in. And you get to ask your questions, but it's a $6 thing for 2-hour Zoom lesson with me and other students. And we'll do a bunch of practice questions together. The tricky ones, the ones that I know you're going to get wrong on exam day. So when you do this class for $6, I'm expecting that every question I give you, you're going to get wrong and you're going to feel really bad. But that's my purpose, right? Because I want to teach you something. So don't feel bad. Like, you know, you're going to be, if you can do all of these questions and not get any of them wrong, then you know you're ready for your exam. So that's for sure. But hopefully, my intention is that you get them all wrong and I show you how to avoid that wrongness um, for sure on exam day. But that's only $6. That's coming up. Let's see, what day is that coming up on? That's next Saturday on the 14th. So we're doing that on the 14th. And then my next boot camp, which is 8 hours long, that's coming up on the 21st. So the next 2 Saturdays, we're doing those. And that's only like $37.77 or something like that. It's cheaper if you buy it in advance because it's that. And then if you want to buy the replay afterwards, like, and you buy it afterwards, then it's $40. But it's cheaper and you get unlimited replays. You'll have access to the video even if you pre-purchase it. Does that make sense? But if you miss it and don't pre-order it, the price does go up to $40 on that later. But you'll get unlimited replays if you pre-order it, and it'll be 8 hours. I know no one can stay there all dang day with me and do 8-hour video while I'm recording it, but you're welcome to if you want to. But I am redoing the boot camp on that day if anybody wants to do it. What do you guys think? Medical Coding by Jen. It is my name up here in that blue little thingy up there. You just go to my website, Medical Coding by Jen, and it is right there on the website. Right there. Big and center. You can book now. Book now. Just go to the medicalcodingbyjen.com. All right. What do you guys think is the answer for this one? Yay for duck class. Yeah. Duck class, duck class. My 2026 study book looks different than others. AAPC is copyrighted, right? Yes. Just hope I bought a legit off of Amazon. The AAPC 2026 study book. Let me show you. The study guide. If your AAPC study guide does not look like what I have in my store, so if you come over here to my store and you hit the More tab, I've got AAPC products right here because I do get to sell AAPC stuff. If your 2026 study guide does not look like this one right here, then yeah, you bought something that is not AAPC. The 2026 study guide is supposed to look like that. Oops, sorry, right here. It's this one, study guide. I sell it too. I have it for $99.95. Their textbook looks like this, but no one can buy that textbook unless you buy the course from me. So don't go in here and try to buy this because I'm just going to have to refund you the money. And then it cost me $26 in fees of the credit card companies, right? I get charged 6% every time you guys buy something from me, right? Just to process your payment. And then to refund your money, it cost me $26. Anyway, don't buy that textbook from AAPC for the CPC course unless you're also buying the course from me. Anyway, but this study guide is what the 2026 study guide looks like. We have a coloring book for anatomy right here. We got all kinds of stuff. But the course options are right there underneath the course options. I have the textbook for the course right here because you can purchase it separate if you also purchase this right here, the course, for $900. So that'll give you 1 year off your certification. You get access to AAPC's course for 1 whole year with that, but you've got to buy a textbook to go with it. Or if you find one used off the internet or your employer has a used copy, that's fine. You can use it. That's why it's separate from the course so that people can get it the absolute cheapest that they want to. I have it there. Or if you want membership and exam attempts and manuals and you want everything all into one, I got several options right there for all that kind of stuff. But some people, they don't need manuals. They don't need a membership. They already have all that stuff. They just want the course and they want me to be their teacher and instructor for a whole year. And you can get that for as little as $900 if you need it. But anyway, I got a ton of stuff on my website. Don't be afraid of it. Click on things, try to break it. If you ever purchase anything, there's a drop down menu on every single page where you can just check on your orders and all that stuff, cancel subscriptions, whatever you want to do on every single page with one click. It's on every single page. So you can, every single page you can check on your order, check on anything. Anyway, to book the boot camp or the duck class, they're right there on the center of my page so that you don't have to go far. They're just right there. Medical Coding by Jen.com. Did anybody figure out the answer to this one? B? B is correct. It's the one answer that is one code by itself, and it's also the cheapest one. Like, it's the smallest number. The 62 is smaller than 64. Good job. Javon? What about this one? A comprehensive metabolic panel with a hepatic panel. Is that 2 codes, 1 code, 2 codes, or 5 codes? Would we have a 52 modifier in lab and path? Is that something that you normally see? I know it's pretty blurry. I'm on YouTube and it's doing a direct view of the screen directly from my device to your device. I don't know why this is so like this. I don't know what to do with it, but it's just a cell phone going to TikTok, right? I can't stream on 2 different social medias at the same time. I don't know what's going on, but this is a Samsung 24S Plus Ultra, whatever you want to call it. I don't know what it's doing. It just does a terrible job of this TikTok stuff. I don't know. And plus TikTok keeps putting all these thingies up there for 59 seconds of, donate here, do this rose here, do that here, which I don't think that helps the screen view at all. It's like, really? I know it's blurry. I don't know what to do about it. I have no idea. But on YouTube, you're getting a much better view, except for when I'm not showing them what I should be showing them. Because I'm going through the cell phone and showing something else off. Like my book notes that I was doing earlier. That's a little clearer. Okay. Hit clear screen. What does that mean? Lord, if I touch that cell phone, I do CCS all the time, baby Ruth. One of my very first people that I ever helped was Jess and Janet. She does CCS. I even have, let's see, on where is Vita Source? I just bought their brand new 2026 workbook. I love, love, love their workbook on CCS. It is so cool. Ahima's clinical workout book is my absolute favorite, one of my favorite books to train with. Love this book. You guys ever seen this thing? This thing is great because they go through every ICD-10, HIPAA, CPT situation in beginner level and ask you a bunch of questions. Then they redo the whole thing again, all ICD-10, HIPAA, and CPTs. Same areas, but then they ask you more intermediate questions. And then they redo it again and ask you every section all over again in advanced exercises. And then they do it one more time all the way through from ICD-10, HIPAA, everything to challenges, like the really tough stuff. I love that. And I think that's an awesome way to learn. Start out with the baby questions, then start out with intermediate questions, then go to advanced, but they redo all sections instead of doing, you know, just like even our AAPC study guides or whatever. Where is where's the study guide? I got so many books. Um, they just go through it once, even AAPC stuff, right? They just go through all the sections one time, right? They don't go through them 5 times and do advanced stuff each time. I got the bucks too for 2026. I buy everything for you guys. Everything that I do and everything that I learn and everything that I teach is from every source. Any source that I could get a hold of that makes any difference to anybody at all. I buy it all. I think I bought 4 Bucks books this year. They don't change very much, but I buy it all. Every anything. I got desk references. I got the everything that AAPC sells and tons of stuff. I buy it all. Yep. And they don't give out any discounts for any of this stuff. See, I've been buying that clinical workout book for I don't know how many years, a bunch of years. Even their lovely little coding dictionary. This thing was absolutely no help whatsoever, but still bought it. But they have it. This is just full of fluff. Absolutely nothing in there that you guys need. So, yeah, buy it all of it. Even these surgery guides, these were crazy things. I was like, what's inside this? What makes this so cool? Is there anything at all? Nope. This is all it is. It's like, what am I supposed to do with that? That is not helpful. And then there's another code. And then there's another code. That is not helpful. I don't know what this is, but that's not helpful. Not for the CPC exam. But yeah, there's 2 volumes of that thing. All right, back to this. What do you guys think? But yeah, I've been helping CCS people since 2019. That's why I even started this. Was somebody asked me on the internet, "Can you help me?" I said, "Sure." I even have PCS notes available that you guys can instantly download and add into your PCS book that you can take and use on your CCS exam on exam day and help you pass. I did those updated for 2026 already and have them posted up. And I have YouTube videos on PCS notes as I made those 2026 notes in the YouTube membership, which is $5. Me too. I've been missing the lives too. My hand is humming, guys. My wrist is killing me. Which school do you go through for this degree? You don't need a school degree. You can get all of your certifications by just passing one exam. A degree is not required. I mean, you can go to any local college and get your associate's degree in applied science and then advance to a bachelor's in applied science, which just means you have a degree and you paid some college a lot of money, but employers don't care about it at all. They're more worried about, are you certified? And to become certified in medical coding, medical auditing, medical documentation, all of that, you just need a certification. And to get a certification, you just need to pass one exam. You are not required to take any classes at all. And you do not need a class to sit for the exam. And the courses are not built to prepare you for the certification exam. They're built to show you how to use your manuals and give you a lot of busy work to get that knowledge under your belt. But to pass the certification exam, it's 100 questions that are multiple choice in 4 hours. That means you have 120 seconds per question. That is a unique skill that you need to develop outside of all of that, which I help you guys do that. For the $5 YouTube membership, you've got access to 4 years I know of, workshops that I do monthly where we go and do 75 questions in 3 hours. And if you can watch those replays, open up your 3 manuals and follow along with me as I display the questions one at a time. And if you can get through and get 90% of those questions right with me as I'm doing it in the videos in that 3 hours without pausing the video, you can flip, find the codes, pick out your correct answers, and do them with me just from those workshop videos. And I've got years of them that you guys can watch for if you got that YouTube membership, then you're ready for your certification exam and you've built up enough skills to get through each question in 2 minutes. I do 2 a year, every year for free, one in April and one in December. And those replays are available for everybody on the internet. If you just go to YouTube channel and look them up, they're there. Sort my videos by how many hour long they are, and all the ones that are 3 hour long ones are the ones that are the workshops. And of course, they're in the workshop folder that everybody has access to. And you can go there and watch all of those. My college program was great at being busy. Yep. And I failed this CPC exam twice after I got the degree. That's correct, Mindy. I even have a TikTok video on my TikTok page where I have the director of education from AAPC legitimately saying that she built the exam, the course, I mean, so that it does not prepare you for the certification exam. That was not its intention, right? For $6,000-$7,000, whatever you're doing, paying for that course, it was not intended to help you pass the certification exam. They keep that separate. Yep. I teach from the certification exam point of view. And I teach you guys how to build that skill of getting through the exam in 120 seconds per question. That's a whole nother thing you got to learn. currently bill for mental health. Oh, and you want the IIC clients? Oh, neat. You would love to get that certification. That would be awesome. Being certified does absolutely get you more career opportunities and more income. The more certifications you have, the better off. I always recommend at least having two. Being an auditor and being a coder guarantees you employment in this field. Somebody somewhere is going to be begging for you, for sure. I mean, as soon as I passed my CPMA, AAPC was sending me advertisements, want me to interview for employment, just teach it. So there's tons of positions out there. Yes. Yes, very sorry. The program did not prepare you for the exam. Hey, Karen. How's it going? All right. What do you guys think is the answer? B is correct. Good job, guys. All right, guys. I got to get off here. I'm going to go check out Travis, go get some dinner. It's 6:30 here. I hope this has been super helpful. Be sure to check out Pocket Prep. Use my little link because they'll give me like $3 if you do purchase anything from Pocket Prep right here. And then I turn that into YouTube memberships for you guys. Don't forget about Project Resume. If you are certified, get Anna and Jacob to help you guys rewrite your resume, your LinkedIn profile. Use Gen 10 as at checkout, and then that'll save you 10%. Amazon list has got everything that you need, whatever I've got on my desk, what highlighters, all that kind of stuff. If you need it, it's right there. We've got a boot camp coming up this month, and we've got a duck class coming up next Saturday. If you want to really buckle down and know why you're getting exam questions wrong, that'll be going on next Saturday. I hope this has been so helpful to you guys. And I will not be here tomorrow. Nope. I got to do open course hours. I got open hours tomorrow for my course students for 2 hours. And then I got to teach a course for 2 hours. So it'll be more likely Monday before I can go live again. But I hope to do some more of these. I hope this was helpful. Be sure and turn on the little bell notification so you know when I go live. They default to a sometimes alert you kind of thing. Hey, Pamela. Thank you for becoming a member. I hope those videos help you out so much. Don't forget to click on anything on YouTube. When you're on YouTube, be sure to utilize those top headers, right? Up here at the top that say videos, shorts, lives, podcast, playlist. Click on that playlist, right? And if you're searching for anything that I might have, there's this little magnifying glass. Don't forget to click inside that too. But go to playlist right there. This is all my playlists that I have. Don't click on the picture of the video that you're looking for. Click on the words underneath it that say view full playlist, like this one that's got the CPT book prep videos, right? Click on the words that say view full playlist. When you do that, it gives you the entire list of all the videos instead of just starting the videos with whatever one they want to play. This lets you look at all the videos underneath that. Like this is all my CPT book prep videos. I have 138 of them. There's something on every chapter, whether it's guidelines or cardio or lab and path. That way you can look through the headers of all of them and say, I want to do anatomy prep right now. I just want to color anatomy. Let's do that. This is the audio book for ears, right? Or if I want to go to the medicine section, or if I want to do respiratory notes. That way you can look up and see which video you want to watch. If you just click on the picture, it's just going to start playing the first video, which is annoying. you know. So when you go to the playlist, click on the playlist, view full playlist underneath the words, right there. View full playlist. Don't click on the picture. But I've got a ton of playlist for you guys. Where's the workshop? The pink one down here is the workshops. So everybody go to the one that says workshops because there's 2 a year for free that are here. Click on view full playlist. Don't click on the picture because it'll just start a video or it'll tell you to go sign up for the membership. Click on view full playlist. Then you get to see all the playlists. And over there to the side, the ones that don't have the green, remember? Those are free. Everybody gets to watch those. So there's a free one, 3 hours from April. You can see April is right there. Then you can watch 75 questions done in 3 hours and 12 minutes. So if you can do all of those, get to the codes, get to the check, and you know where to find the correct answers, and you can do it as fast as I do it for all the questions, and you can get 90% of those right, then you know you're ready for the exam. But there's several of those. I do 2 a year. The pink one up here at the top is the one from December. I just did. So we'll do another one next month. But yep, there's another one from April and all that stuff. There's another one from December. So really cool workshops. Anyway, I hope this is super helpful. I'm going to get off here and go hang out with Travi for a minute. Love you guys. And for those that are taking the CPC course from me right now, I will see you guys tomorrow for like 4 hours. I'll have open office hours for 2 hours if you guys want to join in on the Zoom and just ask me questions. And then I'll see you at 4:30 for our lesson for this week. I hope this was helpful. Love you guys. See you guys later. Sorry if I didn't get to all your questions. You took your exam? Oh, good score, girl. 67. You're 3 questions away. Congratulations. That is awesome. That is really good. First exam, but went back to take it yesterday and received, oh, a 58. You got nervous? Be sure to email me your breakdown of scores at medicalcodingbyjen@gmail.com and I'll see what happened. But it looks like you got really nervous and you missed a concept. Are you checking your red headers before running to the CPT codes in the descriptions? If you are only checking the available answers by running directly to the code and looking at its description and picking an answer that way, then you're going to fail that exam every single time. You can't look at the code and its description and pick a correct answer. You have to look at its header. Are you under the correct body part? And are you doing the correct surgery? Those things are not included in your CPT code descriptor. Those are things that I teach you guys in my duck class or in my boot camp. So join in on those. I hope this is helpful. Love you guys.